Welcome to Pharmside Chat with Pitt Pharmacy. I'm your host, Aaron Devanathan, and I had the privilege of sitting down with two of our pharmacy students. We spoke about their interests and how they are personalizing their educational opportunities. In our conversation, we learned a lot about how Pitt Pharmacy delivers a dynamic curriculum that is centered around the student. So let's get started. Thank you both for being here with us today. Appreciate it.
Thanks for having us.
So Kayla, you're a P3, a third-year pharmacy student, so you've gone through the coursework and you're getting near to rotations. Could you talk about maybe how the coursework or the experience has prepared you for your soon-to-be rotations or even real-world pharmacy practice after that?
Something special to Pitt Pharmacy that I've noticed was their large integration of hands-on learning throughout our coursework. And so throughout the course of P2 Fall, they heavily integrate the Weiser Center down the street, which allows for us to experience patient care simulations and real-world scenarios that we may see in the future and throughout rotations. And especially in our pharmacotherapy of cardiovascular diseases course, I got to collaborate with my classmates in a real-world patient care scenario at the Weiser Center, where we got to identify vital signs, interpret medication-related problems, and make evidence-based guideline recommendations, which definitely helped my learning and prepared me better for rotations and career as a whole.
Now, I think that's great with that practical experience. Now, Sahana, you're a P2, a second-year pharmacy student. Can you talk to us about what the day-to-day is like and how you felt supported as part of the pharmacy community when you entered?
I think Pitt Pharmacy provides a lot of opportunities to get accustomed as well as get adjusted from undergrad courses to pharmacy courses. So we have something called standardized patients where we have interactions with patients just so that it kind of portrays what you would have when you were dealt with real life patients. And for me, I feel like that was definitely a foundational experience where we were able to practice how we would go about talking to a patient, whether that's just the conversation aspect of it, as well as applying what we're learning to talking to a patient. So that was definitely a great way for us to learn how to have that conversation. And then in terms of the day-to-day lifestyle, learning from both my peers as well as classes above and below, it's been a really great opportunity to really see how we can apply like conversation from just not just schoolwork, but study together and have personal experiences as well. So that's been great.
No, that's good. So it sounds like practical experience is what you guys are doing, especially early on in a P2 and certainly into P3. Now, Kayla, you mentioned this earlier about working with your classmates, and of course, being in pharmacy organizations is a key aspect to that. Could you talk about how leadership or involvement in pharmacy organizations has really been quite helpful for you?
Yes, here at Pitt, there's like endless opportunities to getting involved with the school, whether it's joining a student organization or starting one of your own. One that I've been heavily involved in is SNAPA, or Student National Pharmaceutical Association, where this year I serve as the Dean's Theme Chair, and something special about Pitt Pharmacy is that the Dean chooses a theme every year. So this year it's Operation Heart, so we get to spread education and awareness on heart health and everything, and it really gave me an opportunity to not only collaborate within my own Pitt community, but also serve the local communities around me. And as a future provider, I definitely want to be heavily involved in those around me.
Yeah, I think that's really great, especially as a third year. As a second year, Sahana, have you been involved in pharmacy organizations, and what sort of opportunities did it provide you that you may not have gone elsewhere?
Yeah, so Pitt does a really great job with giving us so many different opportunities. So we have like a welcome back picnic in the beginning of the year where they just give us all the options of different clubs and orgs that you can join. And I feel like there's a wide range for any aspect of pharmacy that you'd like to get more involved in. And so for me, I joined APHA, which is called American Pharmacists Association. And then this year I am the pediatrics operation project lead. So along with other people, we are obviously focused in the pediatric sector, and that's something that I want to get, or I want to specialize in the future. So through tabling and getting guest speakers and just really emphasizing our interest, it's been great to get more exposure in the field of pediatrics through APHA.
Now, I think that's cool because you said external speakers, so you get to network with
Yeah.
other people outside of the School of Pharmacy as
For
well,
sure.
which I think is cool.
And also, like, through Pitt Pharmacy, we had career roundtables, and
Right.
so we're able to, like, see and meet different alum. And through that, I was able to meet a pediatric pharmacist, and so I was able to get in touch with her to come back for to speak with us at APHA, so that's been great.
I'm glad you brought that up because career preparation is key. So Kayla, maybe you can talk a little bit about, since you're getting closer to rotations and getting closer to graduation, about career preparation, and if there was an event or some sort of meetup of some kind that really helps prepare you.
Yeah. Actually, she reminded me, last year I attended a residency roundtabling event that was held in Sauk Hall, which is very nice because without Pitt's strong connections to outside health systems and alumni, I wouldn't have gained like the insight that I did on residency expectations and career preparation. And I also didn't realize like the many clinical paths that I could take through a residency program or any program that I want to pursue following pharmacy school. And so that was very nice to connect with the major health systems in Pittsburgh and onward.
Okay, now that's
Yeah.
cool. So Sahana, I noticed you're wearing your white coat. Now, we know students get that in the P1 year at the beginning of their spring semester. Could you describe what that day entailed and what obtaining the white coat means to you personally?
So, as you mentioned, we did receive it in the spring semester. I wanted to highlight the significance of that to me. And so I feel like, unlike other schools, Pitt does it in the spring.
Right.
And so it really meant a lot more, and it was more impactful because it really showed what it takes and like the hard work that it takes to obtain it. And so it like meant a lot more on that day. And I know it was like the looming thing, the white coat ceremony as we entered P1 year, and so the day of, it was just such a great experience to hear from all the alum and all the faculty as they welcomed us into the field.
Right.
And now as I wear it, it just, every time I put it on when we're in the community centers or when we're having patient interactions, it just really signifies the field that I'm entering, and it's just a reminder of the purpose that I want to have as a pharmacist. So.
And it must be good that you, your classmates, your family is there so they get to also
For
see
sure.
this metamorphosis into the
Yeah.
profession.
Yeah, it's great for them to see us and me and my peers as well, like seeing us in that different standpoint. So.
No, that's great. Now I want you both to rewind the clocks in your head. Go back to when you were looking at pharmacy programs, which I know maybe not have been too long ago. So if you were speaking to an admitted student, Kayla, maybe we'll begin with you here. What would be one personal reason as well as one professional reason why someone should select Pitt Pharmacy?
From a practical standpoint, I was a former chemistry major and I was very interested in a health profession, and just recognizing Pitt Pharmacy's reputation and connections to furthering our professional careers definitely stood out to me there. And also their affiliations with large health systems such as UPMC and AHN definitely was a driving factor for me when committing to this school. Then on a more personal note, throughout my years of pharmacy school, the faculty and Pitt community have definitely stood out for me, especially in hard times. I was always able to come to my faculty and they showed their unwavering support for me during these times, and it helped the support outweighed the challenges of pharmacy school.
Right.
And additionally, something that I really enjoy here at Pitt Pharmacy are once a semester we are involved in advisor meetings with P1s, P2s, P3s, and some P4s that are still in the area. And we all get to come together, give each other advice, and just represent a very supportive system for each other. And that really helped me continue to feel motivated and not feel alone in my challenging times.
What about you, Sahana? What would be maybe the top one or two reasons why you selected Pitt Pharmacy, and do you feel that those reasons have been fulfilled thus far in your 2 years?
Yeah, I definitely think that those reasons have been fulfilled. Like Pitt Pharmacy's prepared me in ways that I didn't even know were possible. So the biggest reason I think would be Pitt's connections and Pitt Pharmacy's alumni network. So as we mentioned earlier, Pitt does career roundtables, and so we were able to get exposure to several different realms of pharmacy and talk to different professionals that went through the experience that we did. So it provides both a mentorship and gaining more exposure, and so even through that I was able to meet a pediatric pharmacist who works at the Children's Hospital of Philadelphia, and I was able to shadow her, and just that's something that I want to pursue in the future. So I wouldn't have been able to do so without Pitt Pharmacy's connections and the alumni network. And secondly, Pitt also allows us to gain a lot of, or apply the things that we learn to outside sources.
Right.
So we have something called Silver Scripts, which starts in our P1 year, but is also integrated into our P2 year. And we go to community centers and senior centers, and we provide them with vitals, and also have patient interactions and provide medication recommendations. So that's been extremely beneficial for me, and also with being able to collaborate with my peers to do so. So I feel like neither of those experiences would have been achieved without Pitt Pharmacy.
The word I'm hearing here is opportunity, hearing that quite a bit. Well, thank you both so much for being here with us. We really appreciate it. I think a lot of students, and even prospective students, would really find this helpful to get what it's actually like on the ground level. So thank you both for being here.
Thank you for having us.
And thank you all for joining us for this conversation with our wonderful pharmacy students. We hope you found it insightful to learn about how pharmacy students tailored their experiences here at Pitt Pharmacy. If you enjoyed this conversation and want to see more, please like and subscribe so you won't miss out on how Pitt Pharmacy improves the health and well-being around us. Until next time, thanks for watching. Hail to Pitt.